Dr. Salia's Kiss. He'll be presenting to us on how does undergoing a mastectomy influence breast cancer patients' perception of their body image. Thanks.
All right. Hello. Good afternoon. My name is Salia Kies. I'm a general surgical registrar at Stellenbosch University. So the title of my research is How Does Undergo a Mastectomy Influence Breast Cancer Patients' Perception on Their Body Image? It's a qualitative study done on patients that received neoadjuvant chemotherapy. So breast cancer is the highest diagnosed cancer among South African women, with a majority in our setting that present with locally advanced breast cancer, and therefore they have neoadjuvant chemotherapy before their surgery. Mastectomy without reconstruction is also the most commonly performed surgical treatment in our setting. The impact of a mastectomy on body image has only really been studied in high-income countries with the view of whether or not they would want reconstruction or not. This is the first study, to the best of our knowledge, that look at the impact of mastectomy on body image in patients with locally advanced breast cancer after they received neoadjuvant chemotherapy. So the aim of the study was to determine the impact of mastectomy as on a woman's body image perception who previously received neoadjuvant chemotherapy in a South African public healthcare setting. This is an exploratory qualitative study conducted at Tygerberg Hospital's Breast and Endocrine Surgical Outpatients Department, with the study population being women that was diagnosed with breast cancer who previously received neoadjuvant chemotherapy and scheduled to undergo a mastectomy without any reconstruction, and they were recruited on their 7th to 8th chemotherapy session. A total of 15 participants was recruited to this study. These participants took part in 2 semi-structured telephonic interviews, of which the first interview was pre-operative but after neoadjuvant chemotherapy, and the second was post-operative. These interviews were transcribed, translated to English where applicable, and also analyzed. Institutional ethics approval was obtained. For the purpose of this presentation, I'm only going to look at the findings of the first interviews only. So 4 themes come out of the first interviews, of which the first was support and religion. Now, all of the participants that was part of the study had some form of support system in place with who they could share the diagnosis as well as their proposed treatment, including the mastectomy. Most of them had family members or partners, others can find it in their church community, while others found support in their chemotherapy rooms with their cancer patients, as well as the doctors and nurses that took care of them. So, quote, "Doctor, I told my husband and my children I'm going to have to remove my breasts. They are 100% with me. I'm on 100% with it." Some of the participants also heavily relied on their faith in acceptance of the diagnosis and the treatment needed, or the surgery, believing that it was God's will. The vast majority made peace with the fact that they will undergo a mastectomy and acceptance that the consequent change to their body. They repeatedly stated that this was only doable with the help of their support systems. Theme 2, a means to an end. So for most of the participants, the immediate reaction to the news that a mastectomy was needed was that of shock, sadness, or the feeling of loss. But after some time to digest the news that a mastectomy was needed for their good health, they made peace with it. I did feel a bit sad that a woman, as females are used to having breasts, but like I said, it was also something that I made peace with by myself. For most, mastectomy was a symbol of finality. It almost came as a relief. The last challenge to overcome on a very long journey so far. Yes, very much a sense of relief, almost like it's the end of it all. When we asked the participants what were their biggest concerns and fears about a mastectomy or surgery, it was not the fear of what their body will look like or how their body will change after surgery, but more the concern about the practicality around surgery. Some of the examples was the unknown environment. Will the staff look after them? Will the pain be managed? Who will look after the children at home? Not one single participant mentioned anything about their worry about the body image changing after surgery, almost as if it didn't cross their minds. Being looked after weighed more than looking into the mirror. Theme 3, health over body image. When the participants was asked what the breast symbolizes to them, some of the descriptions was nurturing, sexuality, sensuality, mother and womanhood, woman's pride, beauty and personality. Most of these responses was positive in nature, with a few exceptions that regarded their breast as a nuisance, not much to talk about in any case, or associated it as with illness. Regardless of the positive or negative response, the conclusion was that they don't think that their perception will change, of their body will change after surgery. In fact, the overwhelming response was that even though they couldn't really predict what their body image would be like after surgery, they valued their health more, and then they noted that being possibly cured from cancer will probably have a positive effect on their body image, despite the loss of a breast. I believe it will change for the better. I'm going to be healthy again. I will be cured. Theme 4, the effect of chemotherapy on body image. So this theme was an unexpected finding because our focus was not really on chemotherapy, but on mastectomy. But it quickly became clear that the side effects on chemotherapy was a big contributor to the changing body image in these participants. Some felt physically ill, while others felt some psychological effects, with the majority that withdrew from social contact because they felt self-conscious about their changes in features, as well as being too anxious to go out. I am more at home because it took a big toll on my body. The pain and trying to recover and the side effects. I think it's worth mentioning that these answers was unprovoked, as the interview schedule that I used never mentioned or asked anything about the effects of chemotherapy on body image. In conclusion, so far in the study, it is clear that the impact of chemotherapy on body image is often underestimated, because in our setting, neoadjuvant chemotherapy is commonly given as almost 60% of patients present with locally advanced breast cancer, so I think this finding is of great significance. For our patients, the impact of mastectomy on body image does not seem to be a significant factor, especially if they understood the benefits of the procedure or had an adequate support system in place. Just to add to what Dr. Charles Sururia said a bit earlier, it mirrors my findings quite well that our patients also had some kind of cosmetically tolerant to them. And what was really interesting, even though I haven't completely analyzed my second interviews, there was a lot of similarity so far found between the pre-operative first interview and the post-operative second interviews. So these are the pre-operative findings, and no studies in this subgroup, as far as I know, looked at body image with pre-operative interviews, thus there's not really something to compare currently. Thank you.
Maybe we can take one question from the floor. Yeah, here in the front.
Yes. Maybe for the last.
Okay, more anecdotal. We actually had a student, a master's student, that did a similar study, but in Limpopo province, more rural setting. It's actually sad to mention that the overall fear of mastectomy and body image is more related to the support system, especially in cultural setting where husbands actually shun their wives for mastectomy. It was something I also, it was actually a very somber thing to realize. There's more anecdotal note than a question. Yeah. Just to add on, I appreciate that you're doing a study on this to realize it's made a big impact, specifically in the South African setting with all the cultures that we have.
Thanks. It may be interesting to go back maybe after a year or two and re-interview these patients and see if their perceptions have changed at all. Because I think you did the pre-op, the pre-op interview was obviously as they were going through the throes of chemotherapy, and certainly hair loss is a major psychological impact. It would be interesting to go back maybe a year later and re-interview the patients again. It would be subset analysis and a further study. Yeah, thank you.